Ntandokazi Capa has visited the families of the two infants who were allegedly taken from the hospital's maternity ward on Tuesday night at Dora Nginza Hospital in Gqeberha in the Eastern Cape. The Health MEC is about to brief the media for the latest. Let's listen in.
Eastern Cape. And then we also have Dr. Zuko. He is the CEO of Dora Nginza Hospital. Just to, as a matter of protocols, can we have our phones off so that there is no disturbance? As a way of synopsis, I just want to give a background. Everybody knows that we had two babies that were abducted here at the institution. Most of you were here yesterday, and then the interviews that were conducted. In that, we had a meeting then with the families yesterday, led by the Chief of Staff, who was sent by the MEC to attend to the matter because the MEC had attended the portfolio committee yesterday. Today she also attended the portfolio committee. But yesterday the families, we, MEC, saw it fit that she must come and address the families with some kind of redress on the part of the department. Apologies for MEC, she's a little bit under the weather. Don't worry about the head. She's a little bit under the weather, but she felt that she had to come and meet the families because what has happened to them is very traumatic. We just had the meeting with her, with the families now, and MEC then is going to delve into exactly what happened in the meeting and gave you guys blow by blow, detail in terms of exactly what happened. After that, then we'll have a situation where you guys can pose questions, and so that we appeal that you be brief because she's got to go. MEC, it's over to you. Thank you very much.
Thank you very much, Mr. Manana. Greetings to the media and everyone who's watching. Firstly, let me say, as the department, we are really saddened with what happened. And we felt that it was important that we have an interface with the families so that we do the redress. Firstly, to apologize for the incident. It's not something that you expect when you go to the hospital to give birth. You expect to go out with your bundle of joy. That is why they are called bundle of joys. It's because it's an excitement. They give joy to the mothers. So you don't expect that when you leave, you'll be in a situation where at some point your baby is missing. So as a department, we are really sorry that incident happened, and we wanted to come and meet with the families. Indeed, we have engaged with the families, and we have had a long discussion. There's quite a number of issues that they've raised, and one of those is the customer care in the hospital. They're raising quite a number of concerns, as well as they really wanted to understand what really transpired. And we did explain, as the department, one way or the other, we acknowledge some gaps in the security, as well as on the whole incident. We acknowledge that there are some gaps, and we are planning to redress. But it is also important to highlight that we're trying to understand and make other people to understand that as much as there were some security gaps and everything that has happened, but it's quite clear that it was a planned incident. Somebody planned to steal the babies. That's one thing that we can say. And we know, apologies for that, when we have met with the security cluster, we have engage with them, and we know that the suspect is appearing tomorrow. But what transpired is according to the information that I've received from the CEO and everyone who was here yesterday. The whole thing was planned. The suspect did attend trying to pretend as if she's pregnant, attending the antenatal care that we do, what is called ANC. And she was told that she's not pregnant. But unfortunately, she did not tell the boyfriend that she's not pregnant because she had plans. And she came in and registered under the false name. She's been moving around the hospital. Even the boyfriend bought baby clothes because they were expecting a child. According to her, it was twins. But we want to say it categorically that she was never pregnant. So it's not true that she lost twins, therefore it's not true. She was not pregnant. We don't know what was the rationale or what drove her to want to say she's pregnant when she's not pregnant. So she came in the hospital, registered with a number. She's been here for quite a number of days because it seems as if she was planning to do this. But we know that with our assistance of our CCTV cameras, we're able to catch her, and it was spread around, and the neighbors were able to assist us, and she was brought back together with the babies. As a result, the whole issue now is more of a criminal act, and it is handed over to police. That's basic. We don't want to disclose the name, so for now, because it's a matter that is still pending until she appears in court, then we'll be able to disclose the name. But we want to say it is something that was planned. It's also a situation where we feel that those mothers were not supposed to experience what they have experienced, but we want to sincerely apologize to them. As the department, there are plans in place to look into this. How do we manage the issues of security? How do we manage the issues that have been raised by communities in order to address this? But we don't want to dwell much on this issue because now it's a matter that is before Amapolisa, though we don't want to jeopardize the case as much as we know that there's a confession that has been made, but we shall wait for tomorrow for all other things. But we want to say it clear that it's clear that it was something that was planned. I will end there for now.
MEC, just to alert you that we are actually live on Newsroom Africa. I'm not sure if there's any other news agency that we are live on. Is there any other one? Okay, SABC as well. Thank you very much. If we can have questions then posed, if you indicate which media house you're coming from, and also pose your questions. Introduce yourself and then pose your questions. Sipa?
Good evening, MEC. Sipa Kema from Newsroom Africa. MEC, now besides this particular incident, I mean, there've been, even though it wasn't babies that were kidnapped, but there seems to be issues around the maternity, preemie wards, in terms of the beds and the numbers. But when it comes to it, when you look at the overall picture, it seems as though issues of structural or leadership are also a problem. What is happening or going on with regards to the board issue at this particular hospital? To maybe assist in ensuring that there is leadership?
Oh, thank you. Okay.
MEC, the question of conduct, MEC, you have touched a bit on it in terms of the families. They're raising serious concern when they were seeking for answers, but in terms of the response from the highly placed health officials, where they even said that don't come and make noise here. And this is not the first time that in this hospital we're losing babies. And I found that to be in the center of things, that out of this whole thing that had happened, it's like now rubbing salt in the wound. A mother who had lost a child and getting such a response. What can I say about that? How it was dealt with?
Thank you very much. Elirato.
Just MEC, in terms of the security at the hospital, this person, like you said, changed her identity and obviously marked whether she is pretty much innocent. Then in terms of security at the maternity ward, what security is there that someone is able to come into the maternity ward and take babies out? In terms of the maternity ward itself, what you said, that is there enough leadership, number one, and also in terms of security at the maternity ward to ensure that, like Nima said, this doesn't happen again, because it seems like it that babies be going missing at Dora Nginza is becoming something more. because most of the comments we've got where people coming out and saying it's not the first time my baby was taken from Dora Nginza as well. So there seems to be a clear issue or clear dilemma in terms of security, particularly the maternity ward. Are there plans to try and beef up that? What plans are you currently having in place to do that, and how will this function?
Thank you very much, MEC. It's the issue of the board.
Can I first take these three then?
All right, let's come out of that briefing. We'll give you a sense of what was discussed there. That is essentially the MEC of Health in the Eastern Cape, Ntandokazi Capa. She has firstly apologized to the families of the two premature babies who were stolen from the incubators at the neonatal ward at Dora Nginza Hospital this week. The MEC says they've identified security gaps following their investigations. And of course, as you know, 2 people have been arrested since. And the MEC saying there that it does appear that the woman who abducted the children or arrested for the abduction faked her pregnancy, but investigations are continuing at this point. But we do know the suspects, aged 25 and 26, are expected to appear at the New Brighton Magistrates Court soon.